Before we get too deep into the 6 steps, I want to give a very quick overview of what Flash looks like so that we don't get too deep into the weeds before we have a big picture of what's happening here. So one of the biggest pictures that we can take of Flash is it is a way to process trauma with very, very minimal distress, without the client thinking very much about the memory and while sitting in a calm or pleasant affective state. So there is a lot there in what I just said that is very, very different than many other transformational trauma therapies. So let's talk about how we do that. All of the distress, we're going to activate this memory very, very lightly, and all of the distress that comes out in each micro activation is going to be routed directly to a container. So the idea is that the distress, the little pieces of distress that come out of the memory when we micro activate it, are going to be routed directly to a container. Ideally, none of it sits in the body. So if the distress is being routed to a container, we need to develop the container. So step 1 is where we develop a container. So the container, if you're an EMDR therapist, it has some similarities to the container in EMDR. One of the similarities is that it's a box that holds stuff, holds some difficult stuff. There are other differences that we'll talk about. So again, we develop the container that the difficult stuff is going to be routed into, pushed out of awareness. All of work is done in the calm scene. So step 2, we're developing the calm scene. The calm scene or calm process can be almost anything. And again, in step 2, we develop it. It can be you imagining petting a dog. It can be you actually petting a dog. It can be you watching a relaxing YouTube video. It can be you remembering a lovely beach vacation. It can be you playing a musical instrument. It can be you remembering a concert. It can be a video of a bubbly hot pizza coming out of the oven. It can be anything, but it needs to pretty rapidly shift your mood, shift your affective state in a positive direction. And so step 1 and step 2 form the hardware of the 4 blinks version of Flash. Once we've developed them, we don't have to keep developing them. You can use the same container, same calm scene over and over and over. Step 3 is a very, very, very rapid step. We literally, in transformational trauma therapies, we have to identify the particular individual memory we're going to work on. So the way we do that is we almost like click on it once and then just push it out of awareness. So we're selecting the memory and we're pushing it out of awareness, but we do not want to talk about it. We do not want to snap the mousetrap of the amygdala. We don't want to activate that memory in step 3 at all. The whole purpose of step 3 is to, with one hand, identify it and with the other hand, push it out of awareness. So step 3 lasts about 15 seconds if you're doing it well. Most of a Flash session occurs in a loop between step 4 and step 5. In step 4, we're in our calm scene for 30 seconds at a time, except that every 5 seconds the therapist is saying blink. And when the therapist says blink, it splits the 30-second exposure to your calm scene into 6 5-second exposures. So again, the client is going calm scene, calm scene, calm scene, calm scene, calm scene, calm scene. The blinks get you out. The client goes back in. So we're having 6 5-second exposures to the calm scene in each 30 seconds that we're in step 4. So the way we may think about this is step 5 is where we're lightly activating. Step 4, think of the kind of hardware, step 1 and step 2, being the hardware of this pump, right? In step 3, we're we're hooking a particular hose up to this pump. And our goal is to just a little bit at a time pump some of this memory through these resources, right? Lightly activate container, calm, scene, blink. We're going to lightly activate container. So we're going to think about this as a kind of pump that a tiny bit of the memory is drawn into the pump in step 5. And then in step 4, we're going to process it and move it the rest of the way into normal memory. So over and over and over, 20 minutes, 30 minutes, 40 minutes at a time, lightly activate. We're going to glance at that memory so quickly that we're only giving milliseconds worth of time for stuff to come out. We're not letting the video play. We're not letting the distress hit the body. We're not thinking about that memory more than just a few milliseconds. Stuff gets pulled into this pump. Lightly activate container, calm, scene, blinks. Lightly activate container, calm, scene, blinks. We do this, we do this, we do this until the client gets to the point where they open the door and they tell you, I can't find any distress when I peek at that memory. That's when we go to step 6, and then we walk through, we make the memory a video, and we walk through that video, and then we look for the first place of distress that's in that video, and then we catch it, contain it, do our calm, scene, blinks, and then we find the next piece of distress, catch it, contain it, calm, scene, blinks. We do this until the client can play the memory with no distress on any channel. So again, step 1 and 2, we develop the hardware of this pump. Step 3, we hook the hose up to a particular individual memory. Steps 4 and 5, lightly activate container, calm, scene, blink. We keep this pump going until the client looks at that memory and goes, I can't find any distress. And then that's when we walk through the memory. We walk through it. We walk into the room. We look under the cushion. We look behind the couch. And we check to make sure that there is no distress anywhere in that memory. And then once we're there, we're done. That memory's processed. Permanently, adaptively processed. You will not need to do EMDR on it. You load it up in the EMDR and the client's going to tell you that memory's resolved. So that is a broad 20,000 foot view of Flash. Flash does not exhaust you. If Flash is exhausting the client, you're probably using an imaginary calm scene, which between the blinks, they may be going into 250 times in a session. So it's really hard to make a calm scene 250 times and to be in that calm scene for only 5 seconds at a time. So it's usually a pretty good idea to outsource the calm scene to a video, particularly if you're working with a client with complex trauma, and particularly if for any reason Flash is exhausting the client. Flash will not exhaust you when you do it well. So again, that's a very quick overview. We are not noticing anything in the 4 blinks version of Flash that is not the pleasantness of the calm scene. We are noticing nothing. We're letting nothing sit in the body. We're letting nothing hang out in awareness that is not the pleasantness of the calm scene. So long story short, this is a way to process trauma without distress, without exhausting you, without awfulness, and it just works.